Hi everyone, I'm Dr. Freston Marc Sirur, Associate Professor at the Department of Emergency Medicine, Kasturba Hospital Manipal. Today, September 28th, is World Rabies Day. I'm here to talk to you about rabies and dog bite. First of all, what do you understand from rabies? Rabies is a virus. It's a virus that affects the neurological tissues of our body once it enters our body. This virus is transmitted to the bite or exposure of infected animals, particularly mammals like dogs and other wild animals that may be amongst our urban dwellings. Now, what does one do if one is exposed to the virus? Maybe by a lick from an infected animal, or a bite, or a scratch. The first thing is that you need to wash the wound with a copious amount of water to remove the saliva and bacteria that may be inside this wound. Thereafter, you may have to use an antiseptic around the bite or the scratch, and then report to the emergency department. At the emergency department, the doctors will evaluate what is the classification of this wound. Is it a severe bite, which is definitely infected, or a simple one that only requires a vaccination? But one thing's for sure, any animal bite or dog bite from an animal that might be containing the virus or carrying the virus will require you to go to the hospital at the emergency department, get evaluated for vaccination, and in some cases, if the bite is severe and the exposure highly risky, the doctors will decide to give immunoglobulins or monoclonal antibodies to prevent the virus from spreading into the nervous tissue and causing rabies. Rabies can infect a person over varying periods of time, from a few weeks to months or even years after exposure. So it's very important to take the vaccine and the immunoglobulins after an exposure to a potentially infected animal. Further, how do you find out if an animal is containing this virus or not? Now, it's actually very difficult, but there are certain signs and behavioral patterns that we can notice in some of these community animals or wild animals. One could be aggressive nature, maybe a lot of frothing from the mouth, or it's not eating, it's not drinking water, it's lethargic. There are various kinds of rabies symptoms in these animals, but that's beyond the scope of this discussion. One thing is important, that if the animal is behaving abnormally, it's important to understand that this animal could be carrying a disease, and it's important to keep some distance, particularly if there are children around, to keep those children away from the animal and get the animal tested by the authorities, or maybe taken to a vet if it's a pet animal to get checked if it's been exposed. Now, when it comes to prevention, if you have a pet animal, it's really important, whether it's a cat or a dog, that you take it to a vet and get it vaccinated in time, not only for rabies, but for other infections as well. But rabies remains one of the most important viruses for which vaccination is required in pet animals. And it's one of the easiest and best ways to prevent the transmission of rabies to someone who might be in close contact with this animal. When it comes to community animals, it's important to understand that dogs were once man's best friend, and now they're stray. Because they're stray, there is some part of them that makes them behave just like animals, seeking food, seeking shelter, and sometimes behaving just like its origins, a wolf. In these circumstances, dogs can be aggressive. Dogs can be aggressive during the mating period as well. Dogs can be aggressive if they are provoked, if they are threatened. So it's important to understand that we should not provoke such behavior in animals by aggressive behavior towards them. And if they are aggressive, or if there is a pack around, it's important to keep distance. For example, if there is a pack of dogs around, it's important that we keep our children away from these areas, because children who are running around might seem like a prey animal and make the animal behave like it would in the wild and chase and even bite. So keep your children safe, let them play in a safe area, make sure your community animals are vaccinated by coordinating with the authorities. There are vaccination drives, there are animal birth control drives to control these populations. And I can tell you that here at Kasturba Hospital, we are working with the authorities to ensure that the community animals are safe, vaccinated, and their populations are also kept under control. These are some of the prevention measures that are being taken, and it's with a One Health perspective that we proceed forward. Thank you.